Good morning everybody. Myself is Prof.Dr.R.R.R. Deshpande. Today is a Wednesday, that is 21st of June 2017, and we are continuing the Panchakarma lecture series with the topic of Snehan, and we have already completed the part 1 and part 2 of Snehan. Today we will start with the part 3. Last part we have seen the the pharmacodynamic and pharmacokinetic actions of the Snehana Dravyas. Also we have seen the indications and contraindications. The main contraindication for using Snehana is a Ama Avastha. Whenever there are endogenous toxins, you should not directly start Snehana. First you give the Deepana and Pachana. For that Trikatu tablet is the most important. Today we are going to see the Snehana procedure as such and their steps. So the first step in the latest tradition, when we are talking about NABH, National Accreditation of Board of Hospitals, and they are working very systematically, NAC or NABH, these type of the stakeholding organizations, they are saying that each and every step when you do in your clinics, it should be very systematic, and that system is called as a SOP, Standard Operating Procedure is called as a SOP. So this is the same like a SOP of the Sneha Dravyas. Whenever you think of giving Sneha Dravyas, first thing you should note is about the Arhata and Anarhata in Ayurveda. That means indications and the contraindications. That should be ascertained first. So you should decide which patient should consume the Snehana and which should not consume the Snehana. Second thing, you have to decide about the quantity. How much quantity we should give that particular person. Then we have to decide about the, of course the quantities depend on the majorly Agni Pariksha, his digestion capacity, and also the duration is depend on the Koshta. Koshta is nothing but the sensitivity of the colon. So Mrudu Koshta, they will require the less Snehana, 3 days Snehana. Mrudu, then Madhyama Koshta will require 5 days Snehana. And the Krura Koshta, very hard your intestinal mucosa or the rough and tough, then you will have to give the long duration of the Snehana Karma. Then for that we have already seen the digestive power is ascertained, then of course the general condition of the patient, and then proper quantity is ascertained and that is given, because if you give the Sneha Dravyas in improper quantity, they may produce some adverse side effects. What are the side effects or the adverse effects of the Sneha Dravyas? Basically it can cause the Kapha Prakopa. So drowsiness will be there. The patient will be drowsy. Then his stiffness may increase if there is a Amavastha. Then it will start itching, pruritus of the skin, and he may land into the Amavastha condition like fever, flatulence, etc. Then while testing his capacity, because we have to give the Madhyam Matra Sneha, as I already told you, to decide that Matra, what is meant by Madhyam Matra? The patient after consuming the Sneha Dravyas, he should not feel to eat for minimum 12 hours. For minimum 12 hours. In the morning he will take the Sneha Dravya and in the night he will take the dinner. In between he will not feel any hunger as such. Okay? So that is called as a Madhyam Matra. But we cannot decide directly the Madhyam Matra, so we start with the Rasi Yasi Matra. The word, scientific word in Ayurveda is a Rasi Yasi, that is the minimal quantity of Sneha Dravyas. So this is called as a testing dose. In the modern language, that can be considered as a testing dose is usually 25 to 30 ml. Then mathematical equation is carried out. For example, if the patient takes 3 hours for digesting this 30 ml of the Sneha Dravyas, then how much quantity will be required for 12 hours? That particular mathematical equation will be done. And then that is a Madhyam Matra, and gradually the Matra will be increased. So there are 3 types of the Matras while Snehana Dravyas. Rasva Matra is a very small quantity of Sneha Dravya. Then Madhyama Matra, that is moderate quantity of Sneha Dravya, and Uttama Matra, that is the higher or the larger quantity of Sneha Dravyas. Small quantity of Sneha Dravya will be digested within 6 hours. Within 6 hours, that is Rasva Matra or small quantity. If the Sneha Dravya is digested in 12 hours, that is moderate or the Madhyam Matra. And if your Sneha Dravya requires the 24 hours, that is the Uttama Matra, very high dose. We have already discussed Mrudu Koshta will take the time of 3 days to be get Snehana, and how to determine that even that particular person or the patient, he get a little bit loose motions or the stools, soft and watery stools after consuming even milk or the khichdi of mung and the rice. That khichdi, after eating that khichdi, after eating little bit spicy, he starts passing the loose stool, that is a very, very sensitive intestine, that is a Mrudu Koshta. But and he will never complain of constipation. Madhyama Koshta, Madhyam type of Koshta, he will require, if at all there is a constipation, he will require mild laxatives. What is meant by mild laxatives? Like Triphala tablets, 2 tablets at night, or Abhayarishta, 4 teaspoon of the Abhayarishta, 4 teaspoon of the water, and after 2 or 3 times in a day, that will enough for the Madhyama type of the Koshta. But Krura Koshta will always require Snehana mover and strong purgatives. And strong purgatives are mainly 3 or 4. Their names are very famous. Ashwakanchuki. They are the products of Jayapal. Tablet name is Ashwakanchuki. Then Ichha Bhedi. And third is a Naracha Rasa. These are the strong purgatives as per Ayurvedic knowledge. Virechana Dravyas, Ashwakanchuki, Ichha Bhedi and Naracha Rasa. They are in ascending order. So Naracha Rasa is very strong. If Jayapal is 2 parts in Ashwakanchuki, then Ichha Bhedi it is 4th part, and in the Naracha Rasa it is the 6th part of Jayapal, Croton Tiglium. Then next will be the how to take these Sneha Dravyas. Basically they are given mostly on the empty stomach if it is of Purva Karma, early in the morning. The Anupana or the vehicle should be with lukewarm water with pinch of salt. Because of the fasting, before that giving the Snehapan, fasting should be done until the oily substances is fully digested. That means if the patient is asked not to take any food after he is taking the Sneha Dravyas. There are also some symptoms which will develop during the process of digestion of this Sneha. Some patients will complain little bit headache. Some patients may be little bit vertigo, increased thirst, increased salivation. All this can happen during the process of digesting that Sneha Dravyas. And afterwards, that means whenever the Sneha Pana is complete, that means the person is fully saturated with Sneha Dravyas, then that is called as a Samyak Snigdha Lakshane. Samyak Snigdha Lakshane. So these symptoms will develop after 3 days or 5 days or the 7 days. So their first symptom is a nausea about that Sneha Dravyas. In Sanskrit it is called as a Sneha Vidvesha. Vidvesha. Hatred. No, I don't want now. Enough. That is Sneha Vidvesh, or fully saturated feeling of the person. Second Sanskrit word is Adhastat Sneha Darshana. That means that Sneha Dravya, oil or the ghee, will start passing through your stools. And the patient can see or patient can experience that passing of the Sneha Dravyas through the stool. In Sanskrit, Adhatstat Sneha Darshana. And last will be he will feel that his skin is becoming more oily. His skin will feel little bit more elastic and oily. So this is Samyak Snigdha Lakshana. But if you are giving what you can very small dose in day to day, every day, that Snehapan, the person will feel relief from the symptoms after eating that Sneha Dravyas, and he will feel little bit more hungry after completing the digestion of that Sneha, and also he will pass easily the gases from the stomach. So bloating will be less because Vatanuloman will take place. So this is a everyday Samyak Lakshana after the digestion of the Sneha Dravyas. For example, today I have taken the 50 ml of the ghee in the morning. How I will understand that my that ghee is digested? So after 6 hours I will feel again hunger. I will feel again relieving in my symptom of pain, and also I will feel that there is comfort in my stomach, though there is no heaviness. Gases have been already passed because the Vatanuloman will take place. So after digestion, the next step is the patient is asked to take a lukewarm water shower, and he can consume the easily digestible light and liquid type of diet. Easily digestible, liquid and light type of the diet. Next day again in the morning, same procedure will be repeated. The patient will ask to take the ghee or the oil in the morning, and same cycle will be repeated. So symptoms suggesting the proper oleation that we have already seen. Now I am telling you the symptoms which will indicate that there is a excessive oleation. Excessive oleation. Of course, it is very clear. It makes the kapha saturation more in the body. Stagnation will be there, and the patient will feel drowsiness, nausea, increased salivation, increased nasal discharge, and also anorexia, that is not feeling hungry. So this is about the excessive consumption of the or atiyoga of Sneha Dravyas. Now as we have talked about the Panchakarma process, let me here also clear you the fact that rules to be followed after Panchakarma treatment. This is not the rules only for the Snehana Karma, but rules after doing the Vamana, rules after giving the Virechana. Some basic lifestyle rules should be followed by the patient. Number 1, he should follow the Sansarjana Krama. This is the traditional scientific terminology of Ayurveda. Sansarjana Krama means specific dietary regimen. Specific dietary regimen is called in Ayurveda Sansarjana Krama. Specific dietary regimen, and the principle is from light diet to the normal diet. From light diet to the normal diet. After giving Vamana, after giving Virechana in the evening, he should take only a sort of Manda, Peya, Vilepi or Akrutayusha and Krutayusha. These are the steps that we are going to discuss afterwards also. But Manda, Peya, Vilepis are nothing but the products from the cooked rice. If it is only rice water, no grains of rice, only water after cooking, that much water is added, that is called as a manda. When there are little bit grains and water, it's mixed, that is called as a peya. And when it's a very very soft rice, that is called as a vilepi. So manda, rice water, peya, water plus rice, and vilepi is a soft rice. And the next are Akrutayusha and Krutayusha. Yusha is nothing but a soup, and the simple soup is prepared from green gram, mung. You have to cook the mung, and you have to prepare the soup from it. When it is given processed with the oil or the jeera, then it is called as a kruta yusha. Without processing with the oil, that is called as akruta yusha, only cooking in the water. Okay. So this is called as the samsarjana krama. So it has to be continued for minimum 5 to 7 days after the vamana, virechana, etc. Second thing, after snehapan or after the vaman virechan panchakarma, always consume lukewarm water. This is very essential. Lukewarm water for drinking, lukewarm water for shower or bath. No cold water, because that will be incompatible treatment. In Ayurveda it is called as a viruddha charya. Viruddha charya. Because of the Vaman and Virechana, your all srotasas are open. It is cleaned up. And if you start eating the cold stuff, that will again the block. So to avoid that block, you have to maintain with the lukewarm water. So that is the maintenance of cleaning. Srotasas are cleaned with the Vaman and Virechana. That should be cleaned with the lukewarm water. Third thing, avoid the sexual activity like coitus, because that can also cause the vata prakopa. We should not do anything which will cause the vata prakopa. Also, don't do suppression of the natural urges, vegavadharana, urination, defecation, hunger, thirst, sleep, all these are not natural urges. In Ayurveda it is called as vega. So don't hold it or don't forcefully do it. Defecation, urination, don't make any force. Don't suppress, don't make force. That is vegavarodh and vegavadharan. Also avoid too much exercise or exertion and even heavy work, heavy physical laborious work. Everything will cause the vata prakopa, and that is not expected. Then avoid the sleeping during the daytime and keeping awake till late at night. If you sleep in the daytime, kapha prakop will be there, ama sanchiti will be there, and again there will be blockage of srotasa or the channels. If you keep late at night, if you sleep at 12 o'clock in the midnight or after midnight, what will happen? Pitta prakop will be there, and there will be irritation to the srotasa, irritation, and that can cause the inflammatory process. So that should be also avoided. Then second thing about your digestive fire, because of the stress and the strain of the Vaman and Virechan, your organs are much more delicate. So you have to be very careful about your stomach. You should not give him the burden. You should not give him the burden to the stomach. So your food should be freshly cooked and very light. It should not contain any high calorie diet. It should not contain any spicy and irritant food. Is it clear? Because your stomach is already having the stress and the strain, like surgery. After surgery we keep some rest. Similar, Vaman Virechan are the invasive processing. It is not very simple things. Okay. When you do the Snehapan as a Purva Karma, then there is a breaking day. You should note this particular point as a breaking day. After completion of the internal oleation, the next day, that is after Samyak Snigdha Lakshane, next day external massage is done and fomentation is done. Suppose you have finished on the 7th day, okay? 7th day you consume the last your Snehapan. Then on the 8th day, what will you do? Will do 8th day? No Snehapan internally. Only externally you have to apply the sesame oil to the chest, back, neck. Everywhere you have to apply the oil, simple oil massage in a specific direction and give the nadi sveda or the fomentation. Then on the 8th day, I am talking about the day before the Vaman, in the evening you have to give the kapha prakopak ahar. That means the food stuff which will increase the secretions, and that increased secretions will help for the Vamana process. I repeat, on the 7th day we have stopped taking internally ghee or oil. On the 8th day what we have done in the morning? Oil massage and fermentation. In the night, in the dinner, we consume the lot of Kapha Prakopak diet, for example, Udid Vada. This is specific diet recipe, Udid Vada. Then you will use the yogurt or the curd. We can use the fish, we can use the banana. These are all the Kapha Prakopak dravyas. Rice, of course. And on the, what you can say, the 9th day, early in the morning, we can give him the Vamana Karma. So Udid is called in English as a black gram vada. Then you can use the South Indian dishes like Rava Masala Dosa, not masala but simple Rava Dosa. All South Indian products are having the fermented products. And whenever there is a fermentation, in Ayurveda the word is Abhishandi. So whichever Abhishandi substances, they also increase the secretions inside the body, which is expected for the Vamana. Kapha Utklesha is expected. So this is 1 day break before Vamana, but for the Virechana, as you know very well, there is 2 day break. That means 7th day I have stopped the internal Snehapan. 8th day break is for Vaman, and 9th day you will give Vaman. But 8th and 9th day break, and you give the 10th day the Virechana Karma. So for Virechana 2 days break, for Vamana 1 day break. Repeat, 1 day break for Vaman, 2 day break for Virechana. Now, this topic is very, very interesting for general practitioners because they want the ready-made information. So we will talk about medicated oils and ghees, formulations and indications. So many Keralian companies like CNN, CVN, Aryavaidya Kottakal, many, these companies are manufacturing these oils and ghees. But Ayurveda Rasashala, Pune, Baidyanath, or these Maharashtrian companies or the North Indian companies, they are not manufacturing much variety of oils and ghees. But variety of oils and ghee you will find in only Kerala. Okay. So first is lMedadi Taila. lMedadi Taila is used for gargling whenever there is a toothache, dental pain is there. Sesame oil is also used for gargling. lMedadi oil is also used when there is a caries, when there is a cavity, when there is a pyorrhea, when there is a locked jaw. You cannot open your mouth. Submucous fibrosis is the word. Submucous fibrosis. This patient come to you, definitely. Then they cannot open their mouth. You ask him to do the warm lMedadi gargling. Then there is a hypersensitive teeth. Enamel is gone. Patient cannot tolerate the too much cold and too much hot. Modern doctors prescribe Sensodyne toothpaste, but Ayurvedic Vaidya will prescribe gargling with sesame oil or lMedadi oil. Then it is also used in trigeminal neuralgia. Very interesting. Trigeminal neuralgia. Then there is a lightning pain on the half part of your face, around the ear, around the cheek, around the teeth, around the chin. Then many mouth and throat diseases can be treated with Ayurvedic gargling process. Even as a Snehadravya, I will say milk is also snigdha. So I also ask the patient to do the milk gargling, mouth kaval dharana, for the stomatitis and aphthous ulcer, and it is fantastic results. In the day, whole day, he has to gargling it for many times, as much as possible, 7-8 times every 2 hours, and spit it out. Mouth is gargled with the milk. Second oil is Asana Manjisthadi oil. Asana Manjisthadi oil. It is used for the eye and ear diseases, eye and ear diseases. Many times it is used externally as well as massage on the scalp. Then there is Asana Vilvadi oil, Asana Vilvadi. This is also used as a application on the head for the eye, ear, nose problems. Asana Vilvadi oil. Then Anutaila, Asana Vilvadi oil also can be used as a ear drops for the tinnitus, especially common complaint, tinnitus, ringing sound in the ear, and it's very difficult to treat even with the modern medicine. Many doctors give the complamina retard, but partial result is there. So you can use this Asana Vilvadi oil for the Karna Purana. The word is Karna Purana, filling of the ear with the oil. Next is Anutaila. Anutaila is for the nasya, as you know, nasal drops, for the headache, sinusitis, premature graying of the hair. Then there is a Vacha oil, calamus, Vacha oil. In spite of making it as a nasal drops, a new fantastic idea I can give you. Just take that few drops on your left palm, and with your right little finger you get it, that Vacha oil, and apply inside your nostril. Ask the patient to apply the Vacha oil inside the nostril before going out from home. So the person who is having the allergy for dust, for the fumes, for the pollen grains in the foreign countries, I usually use this trick, and it is very successful. That when he apply the Vacha oil inside the nostril, he cannot be get afflicted with the dust, fumes and the pollen grains. So allergic rhinitis, better use Vacha oil as an application and not as a drop. Only if there is a blocking, then you can use at night the few drops as a nasal drops. Application in the morning and as a nasal drop at night to remove the block. Like in the modern medicine, you use the Otrivin and Nazivion nasal drops, or even spray is available. So better way we can use the Vacha oil as a decongestant. Next is a Bala Guduchadi coconut oil. Bala Guduchadi coconut oil. Bala is a nourishing plant. Guduchi, Tinospora cordifolia, or the Gudvel in Marathi. This is very blood purifier and anti-pitta, very cooling plant, Guduchi. Bala is also Madhura Madhura Sheeta, Rasa Vipaka Virya, Madhura Madhura Sheeta. So this both combination, Bala Guduchadi and coconut. Coconut is also nourishing. All is nourishing and anti-pitta. So this is very good external application for massage in the arthritic patients of rheumatoid arthritis, RA. Rheumatoid arthritis and gout, both are having Vata Pitta predominance pathology. Rheumatoid arthritis is an autoimmune disease, and I am repeatedly telling you, whenever there is autoimmune disease, maximum possibilities of Vata Pitta pathology, or person will be Vata Pitta Pradhana Prakriti. So remember this Bala Guduchadi oil, and even burning sensation of your eyes. Then apply oil to the plantar aspect of your feet. If hot flushes in the menopause, you know this is a very common complaint in the menopause, hot flushes in the ladies. So ask the Abhyanga of Bala Guduchadi coconut oil. Next is a Bala Taila. Only Bala, Sida cordifolia, is a very nutritive plant, anabolic type of the action. So it will be helpful for all degenerative problems, all degenerative rheumatic conditions. In Ayurveda it is called as a Dhatu Kshayajanya Vata Prakop. So degeneration in the cervical vertebrae, it is called as cervical spondylosis. When there is a degeneration in the lumbar vertebrae, what it is called? Lumbago or lumbar spondylosis. Then there is a sciatica, then there is a neuritis, hemiplegia, paraplegia. Use bala oil for whole body massage. Then there are some typical oils of Kerala having typical explanation. Cheriya bala guduchadi oil, CHERIY, Cheriya bala guduchadi oil. This is for cold and headache and applied to the scalp. Next is a bala dhatriyadi oil. As you know, dhatri is a amalaki, best rasayana. So bala dhatriyadi is a best rasayan, and it is also used for headache. It can be used as a murdha taila kalpana in Ayurveda. You can keep the swab on the vertex and make a bandage. That is called as the shiro pichu. Shiro pichu. Pour the swab in the oil, put it here, keep it a bandage, and apply the bandage like this on the head and your vertex part of your head. So this bala dhatriyadi oil is very useful as a shiro pichu, then also useful as a shiro abhyanga, all the four processes. Third one is a shiro dhara, and last is a shiro basti. All four processes together in Ayurveda called as a murdha taila kalpana. Murdha means brain. So these all treatments are very useful for brain. And which oil we have recommended? Bala dhatriyadi oil. Next, bala ashwagandhadi oil. So now it is a double benefit. Potency becomes multifold. Potency is much more increased. Why? Bala is anabolic, ashwagandha is also anabolic. Samanya Vishesh Siddhanta. When homogeneous substances are mixed, property will increase. So whenever you will need very, very strong anabolic, moderate anabolic, only bala. Strong anabolic, bala ashwagandhadi oil. So it should be reserved for the cachexia of cancer, HIV, tuberculosis. Three types of the patient with weight loss. What you will use? Bala ashwagandhadi oil. Never forget it. Next is a bhrang amalaki oil. Bhrang amalaki oil is also used for headache and insomnia. Headache and insomnia. Then there is a chandanadi oil. Chandana, sandalwood, is a very, very cooling, number one cooling plant. So whenever there is a pitta dominant rheumatism, pitta dominant, whenever there is a burning, wherever may be in the body, you have to use the chandanadi oil, a little quantity internally as well and application externally, especially to the feet. It can be used with the insomnia patients, stress patients, burning, hot flushes. Next is a Chem Parthyadya oil. A traditional Kerala name is there. CHEM PARTHY. Chem Parthyadya oil. Especially it is for skin diseases. In the children, when there is a scabies problem, contact dermatitis problem, use Chem Parthyadya oil. CHEM PARTHYDI. Chem Parthyadya oil. Next is a Dinesh, DINESA, Dinesh Valyadi oil. Dinesavalvadi. This is also a typical Kerala oil used for psoriasis and other dermatological problems, skin problems. Next oil is Dhanvantaram Kujambu. Dhanvantaram Kujambu. I have already explained what is meant by Kujambu. When the preparation contains oil plus ghee, that is Dhanvantaram Kujambu. It is also contains Bala and it is well known for paralytic disorders. Even it can used in the Guillain-Barré syndrome. Have you heard about it? Guillain-Barré syndrome, GB syndrome. It can use in the muscle dystrophy, motor neuron disease, amyloid lateral sclerosis, or multiple sclerosis. These are all the neurological problems with degeneration of the myelin sheath. Whenever there is a coating, apron-like coating on the nerves, so that myelin is degenerated as the nerves are exposed. All these are moreover autoimmune diseases. Amyloid lateral sclerosis, Guillain-Barré syndrome, multiple sclerosis, muscular dystrophy. In all these cases, you must use the Abhyanga and the Basti with Dhanvantaram Kujambu. Next is a Dhur Patradi oil, spelling DHUR. Dhur DHOOR PATHRADI. Dhur Patradi oil or Patradi oil is specific for dandruff. Specific for the dandruff. Dhur Patradi oil for. Next is a Gandharva Hastadi oil, internally as a laxative because it contains ricinus. Gandharva Hasta means erend. So this is Gandharva Hastadi oil. Then there is a Kottam Chukadi oil. Kottam Chukadi oil is for rheumatic problems. Kottam Chukadi oil, especially in the acute condition or some traumatic conditions. Kottam Chukadi oil, Kerala. Then Kshira Bala oil. Kshira Bala is also called as a baby oil because both the drugs are soft. Kshira is a cow's milk and Bala is a nutritive herb. So Kshira Bala oil is very, very soft, very delicate. So it is better to use for the children, for the females and also the old people. In Ayurveda it is called as a Sukumar. That means whoever the patient is having delicate body, delicate physique, then there must be not strong oils but very, very soft and gentle oils like baby oil, Kshira Bala oil. It is used for Abhyanga, it is used for Nasya, it is used for Shirodhara, and it is useful for Matra Basti, 50 ml or 60 ml. Every day you can take Anuvasana Basti. So Kshira Bala oil is very, very nice. It is used for rheumatic problems, debility, hypertension, insomnia and rheumatoid arthritis. Next is Mahamasha Taila. Masha is Udid, black gram. Mahamasha Taila. It is also used for paralytic and nervous disorders. Next is a Murivenna oil. Very specific. Murivenna, Kerala. Murivenna. Murivenna for trauma, fracture. But of course, it is very common sense. In the fracture, we will not rub the oil. We will keep the packs. It is called as oil packs and make a bandage. Remember, in very severe trauma, don't rub it. In acute condition, no rubbing is allowed. Suppose there is a sprain in the back, sprain in the ankle. Don't rub it. In the villages, there is a misunderstanding. They call it as that there is a overlapping of the nerves. In Marathi, it is called as Shirevar Shir Chadli. That is very wrong concept. It is unscientific. So in the acute phase, you have to just give the oil packs, warm oil packs, and give the bandage. That will relieve the pain. Okay. So Murivenna is for trauma and fracture and dislocation. Very important. Murivenna, fracture, dislocation and trauma. Murivenna. Next is Narayana Taila from Shatavari, asparagus. Very common in Maharashtra, it is very popular. Narayan and Mahanarayan Tail is for arthritic, paraplegia, sciatica. Then Pinda Taila is very specific for RA. Pinda Taila is very specific for rheumatoid arthritis and gout, Vata Rakta in Ayurveda. Next is Sahacharadi oil. Sahacharadi oil also for Vata problems. But interesting thing you must note down, Sahacharadi is for the lower part of your body. Cervical spondylosis, you will give the different oil like Dhanvantaram, Kujambu or else. But when it is a sciatica, when there is a lumbago, when there is a leg pain, when there is knee joint pain, when there is a hemiplegia, paraplegia, on the lower apana kshetra, on the lower part of your body, legs, then you must use Sahacharadi oil. Then we will start Ghrita Kalpana. After oil, we will start medicated ghee. Oils are mainly used externally. Some oils can be used internally. But ghees are moreover for the internal consumption, oral intake. So, first is Dadimadi Ghrita from the pomegranate. It is given for anemic patients and also for the infertility cases. Infertility. Next is Guggulu Tiktakam Ghrita. Guggulu Tiktakam. So it contains the bitter type of plants and with Guggulu, Commiphora mucul. So it is a blood purifier. It is anti-Vata, anti-Pitta. So arthritic problems with Vata and Pitta. Also for all types of skin diseases, dermatological problems, because bitter taste is always blood purifier. Then it can be used in diabetes mellitus because Kleda Nashana is a function. Kleda is a minute waste product in our body. Kleda. So whenever there is excessive kleda in the body, you must use the Guggulu Tiktakam Ghrita. Next is Indukanta Ghrita. Indukanta. All are Keralian medicines. Indukanta Ghrita for rheumatic diseases in general. Then also chronic cough. Indukanta Ghrita. Chronic cough. Next is Jivantyadi Yamakam. Jivantyadi Yamakam. Yamakam means again oil and ghee together, like Kujambu. Jivantyadi Yamakam. It is used for skin diseases, especially the cracking of the feet and hand. Cracking of the hand and feet. Jivantyadi is for external use. Jivantyadi is for external use, also used in burn cases. Burn. Next, Kalyanaka Ghrita. Kalyanaka Ghrita is basically brain tonic. Brain tonic. So all types of the brain problems like epilepsy, hysteria, Parkinsonism, Alzheimer's disease. So whenever you think of brain problem, to give the strength to the brain cells, use the Kalyanaka Ghrita. Next is Mahatiktaka Ghrita. It is like Guggulu Tiktakam, very similar. But what is the difference? In Guggulu Tiktakam, used for the Vata problems as well. But Tiktaka Ghrita is specifically for only skin diseases, because it is blood purifier and Kleda Nashana. So Mahatiktaka is very good for eczema, psoriasis, But speciality of Tikta Rasa, Ayurveda says it is very good for bone degeneration as well. Asthashtrayanam Vyadhinam. Tikta and Basti Kalpana. Tiktaras, use of Tiktaras is very helping for bone degeneration like and osteoporosis and osteopenia. See, very small differences are there, but in all conditions you can use the Maha Tiktaka Ghrita. Next is Patoladi Ghrita. Patoladi Ghrita is specific for diseases of eye, nose and ears. This is ENT medicine. Patoladi Ghrita for ENT problems. Next is Shatadauta Ghrita. Shatadauta Ghrita. Cow's ghee is washed with water in 1000 or 100 times, Sahastra times. So that name is Shatadauta Ghrita. Shata means 100. So it is very, very, what you can say, the fine in texture and very useful to fill up the gaps and to make the control on the Ushna and Tikshna property. So this is anti-Vata and anti-Pitta. The best application is on the palmar aspect, on the feet with the copper vessel, Kashachi Vati, copper vessel, Shatadauta Ghrita. It can also be applied on the fissures on the palm, also on the herpes zoster. Herpes zoster, viral infection with herpes virus. And next is a last one is Saraswata Ghrita. Saraswata is Brahmi. So it is also like Kalyanaka, this is the best brain tonic. Brahmi is the best medicine for all psychiatric problems and really organic brain problems. Like repeatedly I am telling you which are the brain problems. For example, the smaller children, because of some pregnancy malfunctioning, it is less IQ. Mentally retarded children, start using Brahmi Ghrita. Mentally retarded children having the less IQ. Then there are hyperactive children, hyperactive. They are always uneasy, unrest. So in that also you can use the Shirodhara with the Kshirabala oil and internally Brahmi Ghrita. The speciality of Brahmi Ghrita is, Ayurveda always say ghee should be used as old as possible. Old is the ghee, better will be the results. Old will be the ghee, so there is as such no expiry date unless and until you take precaution of airtight component. If fungus is growing, then that is damage. If your color is changing of the ghee, that is damage, but spoiled. But if it is preserved very properly, Brahmi Ghrita better use of 1 year minimum old. So what in my practice I have done, that I have asked the patient to bring the 2 bottles of, say example, 250 gram of Brahmi Ghrita. Start consuming 1 bottle, okay, and keep another bottle in your cupboard, in your kitchen, okay, good place, without light and without humidity, okay. Next he will finish that bottle which is consuming. Don't take it from the cupboard. Bring 2 bottles again. Bring 2 bottles again. Start using 1 bottle. Keep 1 bottle in the cupboard. So automatically what will happen after 12 months? There will be 12 bottles in the cupboard. Are you getting my point? And 12 bottles he has consumed. Okay, for the first year there may not be old Brahmi Ghrita, but at least from the second year he will start consuming the old Brahmi Ghrita. Why? Because when he will take 1 bottle from the cupboard, he has to replace it from the market, another bottle. Are you following what I am telling to you? It's very interesting, practical things to be adopted. Because if you go to the shop and ask the shopkeeper, give me the 2-year-old ghee bottle, he will no, it's fresh. Rather he will say, no, fresh is better, doctor, take this fresh one. So no, Brahmi Ghrita is better to use 1 year old. And how it can be started from the second year? First year there will be no older, but from the second year you will get definitely the 1 year old Brahmi Ghrita, which is more useful than the fresh one. Is it clear to you? So I think with the 3 Sneha Kalpana sessions, fortunately we have completed practically useful information about Snehana in Ayurveda. Now from the next audio session we will start with the Svedana Karma. Okay. So that is all for today. I thank you very much for patience hearing to my MD students and all who are listening. Today is Wednesday 21st of June 2017 and we have completed Ayurvedic Panchakarma lecture series Snehana part 3. So all who are listening to them, I request that please subscribe my YouTube channel because I am uploading all my audios of these medically practically useful lectures on the YouTube, which is very popular social media in the world. Thank you very much. Take care and all the best to you. Thank you.